So for our last video assignment of the semester, we did an oculomotor exam. So why would you do an oculomotor exam? It helps clinicians determine the presence of and be able to distinguish between central and peripheral nervous system disorders. With CNS testing, you are moving the body and the head simultaneously, or you're moving the eyes while keeping the head still. With PNS testing, you are moving the head on the body. So the components of this exam that were testing the CNS were smooth pursuits, gaze holding nystagmus, saccades, and convergence, which we actually didn't test within this exam, but we definitely could and should have, where the patient would just be focusing on my finger as I would move it towards them, and we would look for pupil constriction and the eyes to stay focused as the object got closer to them. VOR cancellation is also an indirect test of the CNS, but it's looking at the cerebellum's ability to cancel out the movement and thus inhibit the vestibulo-ocular reflex. So within the CNS testing, I'll talk about each one. So gaze holding nystagmus, when we were doing the test, we were looking for sustained nystagmus, because if they just have brief periods of nystagmus, that's physiologic, but pathologic nystagmus is sustained. The saccades, with that test, you're counting the number of eye movements it takes for the patient's eyes to reach the target and back to the nose. And you're also looking for any overshooting or undershooting. Normal is 2 or less. If they do have saccades, a good follow-up question would be if they have a history of concussion, since this is a common presentation. Pursuits, so in the review videos beforehand, Dr. Walter explained the pursuit testing is primarily done only in the horizontal plane, but my lab partners and I decided to add in the H and the X to include examination of the function of the extraocular muscles in addition to smooth eye pursuit. So with this test, you're looking for saccadic or cogwheel type tracking of the target would be a little rigid. And this would be abnormal, especially in a younger patient. And lastly, for the CNS, the VOR cancellation. As mentioned earlier, this is testing cerebellar function, and a positive test would be saccades. You move with the patient and watch to see if their gaze loses focus of your nose the entire time. And moving on to the peripheral components were head impulse tests and dynamic visual acuity. And before peripheral testing, it would be important to check cervical range of motion and complete a VBI screen. So for head impulse test, you are testing the superior vestibular nerve, which includes innervation to the ampullas of the horizontal and anterior canals as well as the utricle. So you tilt the head down 20 to 30 degrees to put the horizontal canal in proper positioning. The quick thrust can be made either from midline to 30 degrees or out here from 30 degrees to midline. A positive test is nystagmus, dizziness, or saccades. And finally, the dynamic visual acuity test. So I asked Megan to read an eye chart with the letters on it statically, so without her head moving, and then again with her head moving. And I was standing behind her, moving her head between 30 and 45 degrees of cervical rotation, side to side, while she read the chart, and compared the difference in lines of completion on the eye chart. So greater than 2 lines is an abnormal result.
Hi Megan, I'm Brittany. I'll be your student physical therapist today. What we're going to do is an exam of your eyes. So we're going to do a few tests that keep your head still and a few tests that keep your head moving, and we're going to see how your eyes move and assess your ability to focus on objects, but I'll explain them as we go along, okay? Alright, so the first one that we're going to do is gaze holding nystagmus. So I'm going to move my finger around to a few different places, and I'm going to hold it there, and you're just going to focus on the tip of my finger, okay? Alright, so we're going to do this side first. And I'm just watching for her eye movements. About this side. And move that up. Alright. And down. And lift the eyelids just so I can see if your eyes are shifting back and forth. Okay. Alright, so the next test we're going to do is I'm going to move my finger around to different places, and I want you to look from my nose. I know I'm wearing a mask, but look from my nose to my finger, and I'm going to say either finger or nose, and you look from my finger to my nose, okay? Yeah. Okay? Alright, nose, finger, nose, finger, nose, finger, finger, nose, finger, nose, finger, nose, finger, nose, finger, nose. Okay. Alright, so for this next set of testing, what I want you to do is follow the tip of my finger. I'm just looking for how you can smoothly make those eye movements. Okay, so just follow the tip of my finger. We're going to start in this horizontal plane first. Okay, other side. Good. All right, now I'm also going to look at the function of your eye muscles. So I'm going to do a little bit of different movement, okay? But still do the same thing, just follow my finger. Good. All right, so this next test, what we're going to do is you're going to interlock your thumbs. So place your arms out in front of you like this, interlock your thumbs, and put your thumbs close together, okay? So what we're gonna do is while your hands are out in this motion, I'm gonna move with you and move your arms. What you need to do is focus your eyes on your thumbs as we're moving. So this is moving, you're not moving your head, you're just moving your whole trunk, okay? And it's testing your ability to focus on the target. Okay, are you ready? Alright, so the next test we're going to do, I'm going to move your head at different speeds, and what I'm doing is testing your vestibulo-ocular reflex. So what I want you to do, I'm going to get lower on the ground, I'm going to flex your neck a little bit down, and what we're going to do, you just focus on my nose, okay? Relax for me. I'm just watching her eye movements. Alright, Megan, so for this last thing, what we're going to do is you see the eye chart over here on the wall. What we're going to do is you're going to read down to the lowest line that you can, and then we're going to compare that with your head not moving to then I'm going to move your head, and we're going to see if there's 2 lines of difference. That's normal. Anything above that would be abnormal. Okay, so we're just going to see the difference between the two.
Okay.
All right. So are you at a position right now where the last couple lines are blurry? Yeah?
Mm-hmm.
Okay, so go ahead and read from the top for me. And I'm going to watch over here to make sure you're saying the right letters. Okay.
EFP, TOZ, LPED, PECFD, EDFC, VP, FELO, PCD, BEFPI, TEC, LEFOD, PCT, FDPLT, CEO, I'm not sure. Okay.
So we'll say the last line that you completed completely was the second to last one. Okay? So now what we're going to do is I'm going to move your head at a certain speed. And then we're going to see the difference between these two, okay? So I'm still going to be watching for letters, but I'm just going to move your head and you just read down the chart like we just did. Okay?
EFP, TOZ, LPED, PECFD, EDFC, ZP, FELO, PCD, BEFPO, TEC, LEF, OD, PCT, FD. Yeah, bottom one.
Okay. So she made it to within one line between the difference. Okay.
So looking back at the recording now, I feel like I could have combined pursuit, saccades, and gaze holding nystagmus into one test by drawing the H and pausing out to the sides to observe nystagmus, and then have Megan look from my nose to my finger while in that same plane and within different motions of the H and the X. So those all probably could have been combined into one test. And depending on results of peripheral testing, the PT might consider BPPV testing to test all the canals to determine the inner ear's involvement with the symptoms that they're having. With CNS testing, it would be most appropriate to refer out.